Okay, welcome. My name is William Schwerin. Work on the recruitment side for our graduate programs in engineering and computer science. Today's webinar, I'm thrilled to be joined by Professor Dr. David Belson within the Industrial and Systems Engineering. And we're here to provide information on the Master of Science in Health Systems Management Engineering. So hello to those in the audience who have joined. I hope you can get as much as you can out to learn more of this webinar, to learn more about this exciting new program that we have launched. We will be joined in a little while by one of the alums of this program who's doing very well, I'd say, currently in the healthcare industry. So the way that the structure of the webinar is going to work is, so I'll go ahead and provide information kind of top level, and then we'll hand it off to Professor Belson to really discuss the health systems program that we have. So welcome to Southern California. Our university is USC. We are a private institution founded in 1880. We are the oldest private institution on the West Coast. One unique thing, I've been working at USC for a little over 13 years that I didn't know prior to coming here is that at USC, we have more graduate students than undergrads, believe it or not. We have about 24,000 total graduate students. Now, within the School of Engineering, I'll talk a little bit about demographics in a minute, but we do have more graduate students in our engineering school as well. The engineering school is not the only school at USC. We have a medical school, a public policy school. We have about 21 academic schools and divisions within the university, okay? And as I mentioned, we're located in Los Angeles. Los Angeles, I feel for a young person, is a really dynamic, great place to be and experience because there's so much to do. You get exposed to a lot, you can experience a lot. So for a college student, it's a really great place to be. It's sunny 292 days out of the year. We counted. It is a beautiful day outside. It's actually a little bit cold on the colder side for Los Angeles. It's about 60 degrees, so it's sweater weather here. But our location is really great. I mean, we're very close to the beach. San Diego is about 2 hours south of us. Silicon Valley and the San Francisco Bay Area is about a 6-hour car ride or about a 1-hour flight north. Sometimes on weekends, students like to go to Las Vegas because it's a maybe 3.5 to 4-hour car ride, not too far from here. And just within Los Angeles itself, there's so much to do. So it's a center for arts, technology, international business. So there really is a lot going on in Los Angeles and also within the university. I believe there's over 700 student organizations within the university. So if you can't find something to do on campus, there's always something to do in Los Angeles outside of your studies. Now, our Viterbi School of Engineering is named after an engineer, Dr. Andrew Viterbi. He earned his PhD in electrical engineering back in the 1960s and is a donor to our engineering school. So that is where the Viterbi name, in case you were wondering, comes from. Some demographic information about our engineering school. I mentioned we do have more graduate students than undergraduates. You see there about 1,000 PhD students, and the remaining portion are master's students. Now, within our engineering school, we have 8 academic departments. Okay, so our master's student population is spread out among these 8 departments. Within these departments at the master's level, you really have a lot of opportunities to specialize in a particular area. So we have 70 master's programs available for students. So a lot of specialties. The Health Systems Management Engineering is one of these specialized master's programs that we're able to offer. In addition, 13 PhD programs. So I really feel that we're able to provide, and you see by our student population, a lot of options and opportunities for students. Now, I should mention, not all of our master's student population are on-campus students. We actually have a significant portion, a little under 25%, are working professionals in industry who are coming back and earning their degree via online delivery. So it's the same master's degree as an on-campus would earn. They're just taking a little bit longer to earn that degree. And this master's in health systems management engineering is available online as well. So we do have that option for students. Okay, so what I'm going to do is hand it off to Professor Belson to talk about this program in a little more depth, and yeah, I'll take it away, David.
Okay, Bill, thanks for the good introduction. I hope you can hear me fine. So I'm David Belson. I'm a professor in the Industrial Engineering Department. I do a lot of work in healthcare. Really, that's all I work in is in healthcare for about the last 20 years. And we just recently restarted this new master's degree program because there was a strong demand for this topic, for this area. It's a unique degree in a couple ways. One way, it's in the engineering school, but it's co-sponsored by our medical school, a Keck Medical School, as well as the Price School, which does policy kind of work. So it's really a degree from 3 different schools within in the university, which I think makes it pretty unique and makes it clear that our ties are in the healthcare area because the other 2 schools are healthcare oriented schools. The master's degree is focused on how healthcare works. What I mean by that is we're not teaching doctors to be doctors. We're teaching managers, leaders, engineers, all sorts of folks to help healthcare work better. And there's a real need for this. I don't know what your all experience has been with healthcare, particularly healthcare in America. There's a lot of challenges. It's too costly. It's too cumbersome. It needs to be much better. And that's what students from this program work on. And the industry knows it needs to be better. It's not a secret. They realize their costs are high. The systems don't work as well as they should. They know it needs to be better. And so that's what this degree is focused on. And here in the US, as well as elsewhere, it is the biggest business. It is the biggest industry. It employs a lot of people and it employs people in this area. So you want to go to the next slide? Also, this program, which we, like I say, recently restarted, has been impacted by the pandemic. The pandemic has made it clear that healthcare needs to work better, and that's what this degree is focused on. There's a shortage of people in healthcare. How do we get the most out of the people doing the job? And so, while it's an engineering degree, and we have various courses related to management and engineering and so on, it's really about people and people helping people and people doing a better job taking care of people who need care. Another thing that makes this program necessary is there's a lot of new things in healthcare which the program addresses. You may or may not have experience of telemedicine, the distance access to healthcare. I teach classes in this area, as well as other people. This semester we were doing projects in telemedicine. How do you make telemedicine work better? How do patients get remote care? How do you schedule that, organize it, motivate people properly, make sure it works well? Supply chains. This is going to headline stuff. Shortages everywhere, but particularly in healthcare, it became really critical. I'm working with and helps in my class the vice president of supply chain for the largest hospital in the Los Angeles area, as well as the second and third largest hospital. We're working with their supply chain issues. There's a shortage of staff, both at the management level, clinical area, as well as engineering. Another factor, depending on your interest, there's increased use of analytics, of mathematical methods, of getting more out of healthcare. So analytics can be an important part of the degree as well. So if you want to go to the next slide. So our courses, there's a number of required courses in things like quality, which is obviously pretty important in healthcare. We're dealing with people's lives, and how do you deal with that? How do you make healthcare work better? How do you make change happen? Projects, how you lead those. So we like to really get people involved in real projects, real improvements that are needed. This last semester, I had a team of students working on, two teams working on surgery, on scheduling. How do you do a better job of scheduling surgery? And so the work can be pretty varied. And also you can vary your program depending on what electives you add into the degree. It can be more tech oriented, more startup business oriented, on the business of healthcare, or you may have more of a clinical interest or an analytics interest. So there's a lot of different directions you can go. Some people get involved in IT. Healthcare IT is the biggest part of the computer industry, so there's plenty of opportunities there. In my class, every semester, I have a speaker or two, a speaker from the largest IT provider in the world comes and speaks to my class. A number of CIOs have spoken to the class. One did this last semester. So the program really involves the healthcare industry. We're involved with it. As Bill said, we're in a big city and a big economy, and there's quite a few healthcare organizations headquartered here. So we get the chance to leverage that. Let's go on to the next slide, and we'll break in a second to give you a chance to ask some questions. One thing I wanted to talk about here is I've talked to a couple recently CEOs at large healthcare systems about this degree. And not only do they want graduates from this degree, they need the graduates to train other people in their hospitals. Not everybody can have the time or place in their career to go back and get a master's degree, but hospitals are looking for graduates of this program to come back to the hospital, come into their hospital, and train others on how they can make the healthcare system work better. The background needed is any bachelor's of science degree qualifies you for admission. And I guess we don't say it on this slide, but we have scholarships also that are targeted specifically at this degree. So depending on your situation, that may be there as well. So I'm going to go to the next slide. As I guess I've already said, the careers could vary very widely, different directions people go. Bill may have mentioned this, but I think I need to emphasize, USC has a great alumni network. So many of the employers in healthcare have a degree from USC. So that makes the job hunting a great deal easier if you're an alum along with the employer. So anyway, in terms of alums, we have here one of the alums who's gone off to, I thought would be a very good example of what sort of career direction you could get into after studying in this area and getting this degree. So Arup, maybe just briefly mention the kind of work you're doing and perhaps how the degree affected that.
Yeah. Hey, everyone. My name is Arup. Can y'all hear me all right?
Yes.
Yeah, you sound great. Thanks so much, Arup.
Okay, yeah, perfect. Yeah, so as Dr. Belson said, I have been in the healthcare industry for about 12 years. The title, we need to update the title a little bit. I used to work at a consulting firm called Copel Solutions. Now I work at a tech company, health insurance company called Oscar Health, where I oversee a couple of states up here in the Northeast. I'm in New York right now. So
sorry, Arup, I'll update the slides for next time.
Yeah, no worries. I was at Cope for 10 years, so and I know we keep in touch, so no worries at all. But yeah, I mean, a little background on myself. I did my undergrad in biomedical engineering and computer science, and then came to USC for this degree, learned from Dr. Belson and the others. And this degree program is really unique in that it's a multidisciplinary approach to healthcare, the industrial engineering and the public policy side, which is critically important, especially in healthcare. You know, I think healthcare loves to talk about how different it is. And while, you know, a process is a process, you know, there is a whole other kind of way to navigate the health system or the healthcare industry and navigate those that work in it. And I think it's really important to be able to not only understand how systems work and how processes work and how to optimize, you know, systems, but be able to speak the language of healthcare and really understand what's going on. Because while there is a lot that can be optimized purely from an engineering perspective, you know, there are people involved. And so I started my career on the consulting side, building what are called integrated delivery networks, and really focusing on something called value-based care. It's really kind of rethinking the business model of healthcare, and one that incentivizes outcomes and keeping people healthy versus the typical model that most industries run on, which is your fee for service, and essentially getting the industry getting paid based on patients being seen by a doctor. So I spent most of my career doing that, and the degree just really helped me understand holistically how the health industry worked, and where some of the gaps were. Being able to understand, where does a hospital fit in the continuum? Where does the primary care provider fit in the continuum? I also got into the weeds on, as Dr. Belson, you mentioned earlier, on Lean and Six Sigma, redesigned clinics and labs and insurance and eligibility processes across the board. I mean, I think Dr. Belson, you and I chatted back in my earlier years post-college, and that I was still using the textbook at my job, specifically, on a daily basis, using the textbook and kind of developing the graphs and charts that we studied in school. Now I work at a health insurance company, a health insurance and tech company. I oversee, again, a couple of states up here in the Northeast. Essentially kind of top to bottom on the business side, growth in membership, growth in contracting, and growth in providers. But the real kind of differentiator is around, again, managing total cost of care, managing people's outcomes. And again, as I mentioned, this multidisciplinary approach to thinking about and learning about healthcare really pays dividends in that I'm able to understand, what's going on in the communities, what is the health of the community, and how do we make it better in the most kind of optimal way? How do we do it in the most efficient way? So, I fully stand by this quote that I've said over here. This has been a great opportunity for me, and has been, the single greatest catalyst for my career, no doubt about it.
Arup, that's great. One thing that I'm hearing you, this points up, is how the healthcare industry is a lot of different kinds of organizations. We think about hospitals, but it's definitely more than hospitals. It's consulting, it's technology, it's insurance, it's manufacturers, supply chain, all sorts of different. Certainly hospitals is a big part of it, but it's more than hospitals, right?
Yeah, there's so much involved in healthcare. It's this big, it's this big alphabet soup to begin with all these different players. Whether you have senior care or specialists or specialties. What I find to be the most exciting part about healthcare, and I think it's the engineering in me, the kind of born and raised engineer in me, is that there's so much opportunity for making it better. What was great in the degree program is that you learned about the history of healthcare in the U.S. and kind of learn how it came about and why it exists the way that it exists today. And then when you take a step back, again, to your point, Dr. Belson, there's so many different players, there's so many different pieces that it becomes honestly a fun puzzle to try and figure out and try and solve. And in the US especially, we're at such an inflection point with what's going on at the policy level and what's going on in public perception and at the cost level that it's just ripe for opportunity. It's ripe for innovation. It's ripe for fixing. And again, coming at this from both the policy and the engineering side, I think positions us to be, the fixers of everything that's wrong in healthcare. Not to sound too dramatic, but I believe it.
Thanks. Yeah, I appreciate your comments. Bill, what's next?
All right. Thank you so much, Arup. Do you have time to stay around in case anyone has any questions for you after I finish?
Yeah. Yeah, absolutely.
Okay. Thank you. So yeah, let me go ahead and finish to talk about just kind of the nuts and bolts of what we look for in an applicant. As Dr. Belson said, you really just need a Bachelor's of Science degree as an applicant. And our master's programs are professional masters gearing students for industry, just as Arup kind of explained how this program was really specialized to help him succeed in his career. So you can enhance your expertise in a specific area. On average, for an on-campus student, it'll take 1.5 to 2 years to complete. Our master's programs are completely course-based, so we don't require research. That's optional for students. Most students just get through their courses and graduate. In order to graduate, you have to complete all the required courses with a 3.0 degree or better. As mentioned earlier, you should have a minimum of Bachelor of Science degree. It is an online application. The GRE exam, actually, this is incorrect. As of September 7th, the GRE is not required, so we will not be requiring it for fall 2022 applicants. Official transcripts simply need to be scanned and uploaded into the online application portal. We do not require them to be mailed physically to the university. We will require a letter, well, a resume or a CV, and then letters of recommendation vary on this program. I believe there are 3 that are highly recommended, so they're not required, but it is definitely encouraged for submission. If there are any international students, there is an additional TOEFL or IELTS English language requirement that doesn't have any impact on admissibility. It's more of a university requirement. Now, application deadlines. So I'm going to talk here a little bit because there is a little bit of flexibility here for HSME applicants, and HSME is just the acronym that we give for Health Systems Management Engineering. So as you see here, our fall deadline for scholarships, December 15th, our final deadline of January 15th. I will say for our Health Systems Management Engineering program applicants, there is some flexibility here. It's not listed on the slide, but we can discuss this after. You can send me an email or Professor Belson. There is some flexibility with these deadlines. Well, there is no PhD, so this slide pertains to both master's and PhD. So I'm going to go ahead and go to the next slide and talk about, obviously, funding. I mentioned there are some scholarships that are potentially available for applicants. This is an example of a typical 28-unit program here on the slide. So we just kind of broke it down. On average, you can expect between $60,000 to $70,000 for the entire master's program. Okay. Keep in mind that the university usually every year increases tuition slightly, 1% to 2%, I think. So again, this is just an estimate to give you a sense of cost. Now, I mentioned our scholarships. So there is a health systems management engineering specific scholarship that we have the flexibility on for the deadline to apply. These other scholarships are Dean's Masters, endowed scholarships, and Dennet Viterbi. These are firm application deadlines for that December 15th. So I won't go into the details of these. Happy to discuss later if should any questions arise. I mentioned Dennet Viterbi. Just go back to this slide. So this is actually an acronym, Distance Education Network. So as I mentioned earlier in the presentation, I talked about how a little under a quarter of our master's students are online working professionals. This is essentially the program that they're doing. They have to meet the same academic eligibility as an on-campus student. And the program essentially is the on-campus lecture that's taking place. It's just being streamed live over the internet to our online students, okay? Our on-campus students do not have the ability to watch it live because they have to be physically in class. However, after the class is over, the lecture has been recorded, it gets archived onto a server for the rest of the semester for our online and our on-campus students to go back and watch as many times as you wish. But our Dennet Viterbi program has been around for a number of years. We're really top, highly ranked for online programs in the area of engineering and computer science. This is a Viterbi school managed and run program. So everything is done in-house. The production, the recording, it's a completely in-house program in delivery system that we manage in-house. Some facts and figures, we have these on each of our department and degree program pages that if you are interested in. Essentially what happens, because our student population is so large, we are not able to place students into jobs. So we do send a survey We have career offices both at the university level and the engineering school level. And these career offices work with our students to help point them in the best direction on employment, on interview prep, salary negotiation, brushing up on your resume writing. So there are resources available both at the university level and within the engineering school that I really encourage students to take advantage of. And these infographics are essentially what we do is we send out surveys to students when they graduate. They're not mandatory surveys, so it is a voluntary response. And our response rate is not 100%, unfortunately. So we do our best with the data and try to publish in an easy to digest format for students. And so this is data from, I think, 2019 for CS. This is used as an example, but if you go to our Health Systems Management Engineering page, we have it for a broad overall picture of our ISE Industrial and Systems Engineering department. Okay, so we're down to some Q&A. I'll briefly go through this, and then we will have time. If you do have a question, please feel free to ask in the Q&A. Go ahead and type it in the Q&A portion of your Zoom menu. Teaching and research assistants. So I'll go to this first question. Are TAs and RAs available for master's students? So as it says there are limited TA opportunities available. Essentially, our TA and RA ships are reserved for PhD students. There have been instances where a master's student has obtained a teaching or research assistantship, but it is rare because they are reserved. So we tell students don't rely on or expect to receive a TA or RA ship. There are on-campus jobs that are available for students to apply for, and that's what a lot of students end up doing. What impact does work experience have on an application? Well, work experience is not an application criterion for majority of our programs. We're really looking at your academic background, how well you did overall, how well you did specifically in your engineering, math, science related backgrounds. Go ahead and include in your resume or CV any relevant work experience, however. What should I write in my personal statement? So a personal statement is required for all graduate program applicants, actually. But you should describe your reasons for applying, your interests in this program, any career interests, future career plans. Maybe there's something in your academic background that looking at a transcript, our admissions office is not going to be able to infer. So you can explain that in a personal statement. So there's some flexibility there as well. I like to say that it paints a picture on the qualitative side compared to a transcript, which is giving quantitative data for our admissions office about yourself. So next steps, these link to specific pages. I'm going to skip through this and now just open it up to Q&A for either myself, Professor Belson, or our alum who is joining our group today. Thank you so much to those who have already asked, and I'll open it up right now.
I'll answer one question. I don't know if it's still up there, but it was a question, from a current physician. And in terms of physician, I've had a number of physicians in my classes, and I do a lot of work with physicians. We have an advisory board for this program. About half the board is our MDs. And in terms of the curriculum, the question was about the curriculum. A little bit was in this slide. If you want to email me, either Bill or I can provide you details on the curriculum. My experience in working with MDs is, if you are an MD, you're very aware of this. There's all sorts of different MDs and different levels of interest in terms of management and systems improvement, that sort of thing. I think I can definitely say some of the most effective work that I've done in healthcare improvement has been in collaboration with MDs. I don't know, Roop, you have any thought regarding MD in this program?
I think so. Whenever I make changes in healthcare, whether it's the hospital as a consultant, whatever, to your point, Dr. Belson, the best change occurs when you have a physician champion with you. We call it this physician dyad. I think to the extent that this is something that interests you, it makes a very powerful set of tools. It really does. And I think, as I mentioned before, the policy side of this program helps you understand, the softer side of healthcare, as a physician with that natural training and understanding of how healthcare works, with some of the training that you get on the engineering side and the process improvement side, really becomes a powerful toolkit.
Yeah, I was just talking to somebody this morning about dyad leadership, and by dyad we mean that a lot of the systems changes that get done involve in healthcare. In hospitals, there's in many cases a dual leadership, the management side and the clinical side. So you kind of need both to make things happen.
Yeah, I completely agree.
Let's see. Bill, this question.
Question about major qualities of a potential candidate. What is the advisor approved electives?
Well, one thing I'd interject here is,
Yeah.
well, we're in an engineering school, and we do assume a certain amount of kind of that sort of thinking. It's not entirely the case in this particular degree. So a lot of it involves leadership, change, teamwork, and work a lot with the largest hospital in LA. And in their recruiting materials, they say the number one criteria they're looking for is leadership. So it's in a variety of different qualities. In terms of electives, I think I mentioned that a little bit. Could go more in the business direction, could go in more in technology direction, economics. Have a fairly long list of available electives.
And then in terms of class schedule, or are there evening classes, courses in the summer? Do you have any information about that?
Yeah. Most of the classes take place in the evening. And as Bill said, they're all accessible online, either live or recorded. So the time schedule sort of doesn't matter all that much. There's opportunity over the summer. Most of the classes, however, are in the fall and spring semesters. Any kind of work experience certainly is a plus. Admission is kind of a combination of all the different aspects of the student.
Yeah, and I will point out, this student Onyx asked about GRE is actually not required for fall 2022. So for equity purposes, it won't be taken into consideration even if it's submitted. So thank you for that answer, David.
Okay, I don't see other questions.
Yeah, I don't see any other questions. So
in any event, I think they have our emails. If you do have questions, let us know.
Would you mind leaving your email in the chat? Should any?
Yeah, I'll do that right now.
Thank you.
It's pretty easy.
Yeah. Okay, thank you so much. So those of you joining, Professor Belson, he left his email in the chat. I will go ahead and, should you have any kind of general questions about the application process, I'll leave my email in there as well. Thank you so much for joining. That about does it. If we have no further questions, it looks, yeah. I think that's it. Yeah. So I want to thank our guest, Arup. Thank you so much for taking time out of your schedule today on the East Coast. I appreciate it. We definitely appreciate our alumni network. As David mentioned, we have a strong alumni network. This is an example of it right here, our alums giving back. So thank you, Arup, for joining. Professor, any final words before we close up?
No, this is fine.
Great. Okay, well, thanks so much, everyone. Enjoy the rest of your day, and we will get this uploaded onto YouTube probably in the next 24 hours, and we'll send a link for you to have access to it. So thanks so much. Have a good day.